Okay, I just want to make sure that everybody can see me. This is my first live in a few months. I had to take some time off for family reasons, but my goal here today is explore explore a few things that are deep to what it's like to be a girl. Okay, so I'm just gonna working through some kinks. Here we go. I think this is a lot better. So first of all, for those of you who don't know me, I am Dr. Verdiales, okay? And I will write my name such that you all know who I am. My first name is Maribelle. And I will share with you a journey that I've been through for a while. And I want you to share your journey with me. So my name is Maribelle. I was born in San Juan, Puerto Rico in the Caribbean, sometime in May 1974. So I am 47 years old. I own it. I am proud of the 47 years I've lived in this world. And I'm very proud to be a Puerto Rican. And I'm very proud to be a citizen of the world. Really, I've lived in different places at different times for different reasons. I am a mother of 5. I have been married 4 times at the time. Hopefully 4th is the charm. And I've had every ending to a marriage, and I'm hoping for the happy one on this one. I've been through the nasty divorce that some of you know about, the ripping your eyes out, fighting for custody, fighting for all sorts of things. I am a widow. My second husband died of rectal cancer after a very tough battle for 4 years. And I had a happy divorce, believe it or not. My third husband came in and just said, you know, this is really not for me. And I'm on my 4th marriage, and I am very happily married at this time, and hopefully it'll be the one. Like I was saying, I am mother of 5. I have 5 beautiful daughters that I'm very proud of. My oldest daughter is 19 and my youngest is 11. I've been through all sorts of womanly, motherly adventures, from C-sections to emergency deliveries. My 4th child was a NICU admission because I had a placental abruption. For those of you who don't know what that is, I fell down the stairs and the baby's placenta detached from me. So that was quite of a stressful adventure. I have been through the stresses of potentially having a child with disability. My 3rd baby showed some sign of Down syndrome while she was in uterus, and I had to go through an amniocentesis to make sure she did not have Down syndrome. So I've been through a journey as a woman, and I wanted to share it with you because it's real. And one thing that I realized as I've been through my own journey and through learning, through books and through life experiences and through my patients, is that we are not designed to do this alone. Not only we're not designed to do this alone, but also we are designed to do it together. If you look at old civilizations and indigenous cultures, women would create a group. It literally took a village to raise a child. Why? Because we all worked together. We supported each other. We helped each other through womanhood, through motherhood, through breastfeeding, because that could be challenging. And we have lost some of that. And I want to recapture that because I had to do it alone for the most part, and it shouldn't be that way. And I want to create a sisterhood online and out of line and whatever it takes so we can recapture that collaboration, that womanhood, true feminine divine, to help each other grow through the stages of being a girl. So I'm sharing my story with you to open the forum to create a safe environment for you to share your story, because maybe your story will inspire somebody out there that's watching this video right now and help them through whatever challenge they are going through. Our modern civilization isolates us, which I don't think is right, but it isolates us. It's about, you surviving in the world and you're doing it alone, whether it is your first child and you're going through the challenges of taking a newborn home, or you're going through some, tough changes in your marriage. I see it in my patients, you know, challenges through their marriage, challenges through menopause. Our bodies change dramatically as we age, and it brings some challenges to the marriage. But you don't have to do it alone. And that is my point. That is my point for you. So I'm encouraging you to come and share your story with us. Share, what have you learned? There's no bad moments. Even through all the challenges that I have been through, I am owning it. I am proud of being the woman I have become because of those experiences. And they all taught me a lot of things. There are successful lessons and successful victories. We are not designed to have victories on every story that we go through, but then we do get a lot of good stuff from the lessons that we go through, even if the end is not exactly what we had anticipated. So I encourage you, come on, share your story. What do you have to share? What do you have to ask? We are here to answer. All right, so let's see. So I had a patient earlier talk to me about her story, and these days I'm mostly doing fertility, even though I still do a lot of GYN. I still do a lot of sexuality dysfunction, and so this patient was talking to me about her personal challenge, and I want to share it with you as her story. She is 43 years old, and she has two beautiful boys, but it is the desire of her heart to have a little girl. She went through IVF, and that was unsuccessful with her own eggs. She went through donor eggs in order to have a little girl. You can actually test your eggs to make sure that it's a female that you're transferring in, and the first transfer was unsuccessful. She ended up having surgery to realize that she has endometriosis, which it's kind of a condition where the inside of the cells of the uterus actually grow outside of the uterus, and kind of around the female organs. So that could have inhibited the transfer. And she was at a crossroad. Aren't we at a crossroad a lot of times? And she was asking me, what did I think? Should she quit altogether? Or should she keep going? So what do you think? I'm putting it out there, So I am, my thing, I told her, you should keep going. As long as there's life, there's hope. Okay? Do not let anybody tell you what your dream should be like or what your journey should be like. So I told her, just keep going. And I think she has 2 more female embryos from the donor eggs she used. And she's going to go ahead and keep going in her own journey. And she's getting ready to actually try to transfer another of her female embryos to see if she can get that little girl that she wants to have so much. All right, so let's see. So I have a lady. She is wondering, what to do after coming back from that postpartum situation. Postpartum is a rough stage. I've done it 5 times, which sometimes I wonder what was I thinking, but I love all my kids so much. Postpartum is a rough stage in a woman's life. You're pregnant, you're round, you're beautiful, you have your baby, and then you're deflated. And then you look at yourself in the mirror. You're not pregnant anymore, but you're still not quite where you would expect to be. Breastfeeding, it's a great thing. It's a great thing for children. It's a great thing for mothers. It is protective against breast cancer, ovarian cancer, osteoporosis, Alzheimer, colon cancer, ovarian cancer, uterine cancer in the mother. It will help develop the immune system in the child, and breastfed children are shown to have a 10-point higher IQ than not breastfed children. So I breastfed all of my kids, even though I hated it, I admit it. I absolutely did not like being a milking cow, but I was doing it for them because I wanted them to get the best benefit, and I would totally self-therapy about the benefits on me. However, your body actually will hold on to the last 8 to 10 pounds. You still, like you're breastfeeding, you're still kind of roundy, okay? So the idea that breastfeeding will help you lose weight, it'll help you lose the first few pounds, but then it'll kind of hold on to whatever reserve you have, thinking we might need it for milk. But the rest is a lot of effort. It is on you. What I would recommend postpartum moms is it took them 9 months to get to a full pregnant stage. It'll take them 9 months and a year to go back to where they would like to be. Be kind to yourself. Just be kind to yourself and take it easy. Obviously, if you're hitting the wrong foods, it's not going to help. Breastfeeding actually makes you kind of hungry. So if you're breastfeeding, try to go for the yogurt and the fruits and even meats, and try to keep it kind of low carb. But the reality is, at least for me and for a lot of patients that I talk to, it's like breastfeeding makes you so damn hungry. And then just be kind. It will get better. And then once you're done with that stage, whether it's whatever amount of months, 6 months, a year, 3 months, whatever time you're going to breastfeed, just be gentle to yourself, be kind, and then go back into an exercise, regimen. I like doing a lot of high intensity interval training. That will get some of that weight off really quickly. Go into a low carb diet. At the fertility clinic, we talk about keto diet a lot. But with food, it's not all or nothing. You can actually do a low carb diet, get off the grains, processed foods, alcohol, blah, blah, blah. And then gently get off that weight and be kind to yourself. Again, you did not get super pregnant overnight. It took 9 months to get there. It'll take 9 months to a year to get back to where you want to be. Okay. So be gentle. Alrighty. I have here about Hashimoto's. Do you give treatment for Hashimoto's integrative alternative? Absolutely. Hashimoto's is an autoimmune disorder for the thyroid. Hashimoto patients or Graves' disease patients, both of them are autoimmune thyroid. I would strongly encourage you to get off wheat. The gluten molecule interacts with the thyroid, and it kind of stimulates that autoimmune reaction. So anybody with thyroid disease should not eat a lot of wheat. I personally do have a thyroid condition, and I know it's hard. Gluten is everywhere, but I do try to stay away from it. And we can treat any autoimmune disorder with a combined integrity approach. What do I mean? We can do natural health and traditional health together. It's not one or the other. I am an MD, so I'm a traditional Occidental doctor. I am a naturopath, and I try to put it together. So the least amount of medicine we use, and then potentially some other alternative, either herbs or mineral supplements, diet modification, to try to use the least amount of medicine to get you to a place that it's optimal. Okay. Hi, everybody that has joined me. I know I've been out for a while, and I apologize. I will be getting back online a little bit more often. I love you all. So Amy is 44 and just had a failed transfer, IVF transfer. What do you recommend? Do you go back to back or skip a cycle? Just jump on it, unless there's an issue. Okay. Okay. My first transfer was successful, but she lost her baby girl at 17 weeks. I'm so sorry, baby. And so you had a journey, Amy, huh? Okay. So you've had a successful IVF, and you lost your baby girl at 17 weeks. I am so sorry. That's kind of that's a very, very, very strong heart journey for you to go through. And you're just wondering what to do next. Honestly, your case is very complicated. I would encourage you to text me. You're all welcome to, write me through Maribelle Verdiales, MD. Let me look at your case, Amy, and see how can I help you, and what happened with your loss at 17 weeks. And then I can help you more clearly see what can we do differently so you can stay pregnant and make it to full term or near term for your next transfer. Have you done an ERA? Have you done an endometrial receptivity assay? Even though, you did have a successful transfer, have you been on the immune protocols? Did you lose your pregnancy because of early contractions, or was it, deficiency in the cervix? Do we need to put a circulation in place? All of those things we need to discuss at more detail. All right, so just go ahead and write to me, and I'll get a staff member to get you on my schedule. So going back to you, all of you that either are seeing this right now or will be seeing this in the future, I want you to share your journey. Are you dealing with infertility? Are you dealing with sexual disorder? Are you dealing with menopausal symptoms, depression? Are you in an abusive relationship? Are you dealing with a loss of job? I had the other day a lady, and she had a really, really hard time, and she was coping with feeling inadequate because her 20-year-old business had just collapsed, and she had to make the decision of letting all of her employees go, closing down her business, and just get a job for somebody out there just to sustain her bills. She was in her early 60s, and that was a rough time for her. What is your story? I want to know what your story is. Is it what if it's a love story that it's not quite there yet? And just like me, it took 4 marriages to find Mr. Prince. So share it with me, share it with us, and so we can all learn from each other. We can all support each other in this journey of being a woman in this world. All right? Okay, what else do I have here? I lost my pregnancy. So Miss Amy saying, I lost my pregnancy due to a tear in my cerclage. I had an abdominal cerclage put. Okay. Um, so so Miss Amy, if you had a tear in your cerclage, that means that you actually went into preterm labor. A cerclage is in place for people that have deficiency in their cervixes, okay? Meaning that, the cervix is not strong enough to hold itself closed. But if you actually tore, that means that it ripped because you were having contractions. So we have to find a way for your uterus not to contract, okay, to kind of really relax and stretch appropriately. There are many ways of doing it. So go ahead and text me individually, and I will look at your chart, okay? Hello, everybody that's joining us, okay? What is the effect of birth control? So birth control is very interesting. It's something that we as women deal with all the time, and we have to navigate that challenge. So we have hormonal birth control and non-hormonal birth control. With the hormonal birth control, we have the injections, we have the implants that goes in the arm, we have the IUD, and we have the birth control pills. The non-hormonal, we have condoms, female and males. We have the non-hormonal IUD and the spermicides, meaning those creams that will kill the sperms. Birth control has a lot of side effects. They're short-term and long-term. The most common short-term would be, bloating, will be mood changes, nausea, breast tenderness, depending on the amount of hormone you have in them. And then long-term, it is debatable. I have seen women that have been on suppressive, so birth control pills, for example, 15, 20, 30 years, and they end up with some significant ovulation disturbances. Same thing with the progesterone only, so the arm one specifically, and the injections. It has a very long return to fertility phase. So you really want to discuss that with your doctor. I would not encourage any woman to be on one particular birth control for more than a few years, and even give your body a little break, okay? And it's just logic. If you suppress an organ long enough, it stops working, whatever organ it is. So you want to go through some phases where you allow your body to ovulate, okay? If you're thinking of having babies down the road. Now, going back to what we're here for, this pandemic has been a blessing and a curse all at the same time, in terms of what it has done to us as a community and individually. Personally, it actually has been some sort of a blessing. I had to go within me. I mean, when all the paradigms are just destroyed, what we know as structure is just taken down, it allows you to go back inside of you and reevaluate what's important, who are you, and where you want to be. So I think that's why we're here right now, just trying to redefine yourself, okay? And I think that's part of the internal work that I've been doing, and that's why we're here right now, because it made me think about where I've been, what I've learned, and where am I going. And it takes us back to where I started this discussion tonight about where you've been, where you have been, and what have you discovered, and where do you want to go. So again, go ahead and, share with us your journey, and just own it. Just own where you've been, and take a moment, take a deep breath. Who are you, and where do you want to go? And as always, be blessed, be grateful, and be whole. Okay? So we will continue a lot of conversations in the future. I am back online. I am back with you and for you. And for those who don't know me, I am Dr. Maribelle Verdiales. I love you and be blessed.